Our 32 exhibitors specialize in pharmaceuticals, healthcare, infant feeding nutrition, technology, and community programs. Along with our scheduled standard breaks during the day, we have a special time outside of the education set aside this year from 10 a.m. to 11:30 a.m. on October 29th to visit the exhibit hall. Each virtual exhibit has information and resources for you, along with a chat feature, a quick click of a button, and you can interface with an exhibitor from the comfort of your own home, office, or sofa. They have worked very hard along with our staff to create digital environments to foster a meaningful engagement and resources to utilize for your patients and families in the days following the meeting. This year, we have 32 opportunities for you to win nearly $2,000 in gift cards by playing our Ohio AAP Exhibitor Scavenger Hunt game. All you need to do is visit the exhibit hall, click the logo of who you would like to visit, click the chat link, strike up a conversation, and you will receive a clue for the Scavenger Hunt game. Everyone who submits responses will be entered into a raffle to win prizes, and you do not need to be present during the drawing at 5 p.m. on October 29th, as you will be notified via email by the Ohio AAP. Our exhibitors and our supporters are huge reasons why we are able to provide this education to you at no cost this year. Please just take a moment to pop in and thank them and introduce yourselves. They would be so grateful to meet as many of you as possible. I know we all miss the hustle and the bustle of a live meeting and being able to interact with our industry friends. And I know they truly appreciate being able to say hello virtually. And we look forward to next year to being able to meet with our supporters in person. Have a great meeting, everybody.
When I was 2 years old, 1968, I unfortunately drank liquid Drano. I heard I was thirsty and there weren't child safety caps, and so my sister went over to my neighbors and they came over and drove me to the emergency room. They told my parents that there was nothing more that medicine could do and that I was literally in God's hands. And around that time, somebody made my parents aware of a cardiothoracic surgeon by the name of Dr. Gabriel Sabka. That surgeon in 1968 did tableside biomedical engineering and told my parents, I just hope it gets them far enough that medicine comes along and is able to do something better. Well, here I am, almost 55 years of age, with the exact same esophagus that Dr. Sabka constructed. I feel a calling to the medical profession that although their education and training has done a wonderful job building a skill set that generates them a very significant income, unfortunately, doctors don't have the best track record on converting that significant income into wealth and the clarity and the confidence that comes financially with that.
The people that I work with, they're very skilled in what they do. So surgeons are very skilled in surgery, healthcare executives skilled in delivering healthcare, but I'm not an expert in personal and financial planning for myself and for my family. And having people like John help me and help others who understand our life, the goals that we have, and incorporate that into the planning has been very helpful, and I really appreciate that very much.
The same thing in medicine. I'm not going to use all these big technical terms when trying to explain to a patient, and John's able to do the same thing when it comes to financial planning and the impacts of markets and things like that. If I had to make it akin to medicine, he's got a great bedside manner. They know me and they know my family, they know our situation. That concept of trust and relationship is not just with John and myself or John and his clients, it goes for the entire staff, and I sense that sincerity in them.
I really view this as my way of serving and giving back to a profession that has given me my very life.
Through decades of research on infant nutrition, we've focused on a special type of prebiotic. HMOs, or human milk oligosaccharides, are one of the most well-studied components of breast milk. Abbott has contributed to this research for over 25 years. HMOs are the only major prebiotics found in breast milk. and the most abundant solid component after lactose and fats. HMOs have unique structures, and emerging science suggests that they can work in unique ways other prebiotics cannot. We know there are 3 categories of HMOs: acetylated, fucosylated, and sialylated, or A, F, and S for short. Within those categories, these are 5 of the most abundant HMOs commonly found in human milk. Each HMO not only has a unique structure, but they're also believed to serve different functions for brain development, immune support, and digestive health. Preclinical research suggests that HMOs support digestive health. HMOs selectively support the growth of beneficial bacteria in the gut. And HMOs may also support the developing immune system. In cell culture, each HMO acts as a receptor decoy to block specific pathogen attachment. This means that different pathogens attach to the HMO decoys instead of the epithelial cell's walls, which helps block adhesion. In preclinical data, the unique structures of specific HMOs allow them to bind to immune cells to support a more balanced immune response. Preclinical research also suggests that HMOs play a beneficial role in brain development through communication via 2 pathways: circulation and the vagus nerve. In the first pathway, fucose, sialic acid, and microbiota-derived metabolites are absorbed into the bloodstream, where they can travel to the brain to support cognitive development. And in pathway 2, these metabolites and 2-FL-HMO may activate the vagus nerve, which stimulates the developing brain. Human milk concentrations of 2-FL and 6-SL-HMO have been associated with measures of improved cognitive outcomes through 24 months of age. To recap, just remember 3-5-3. There are 3 categories of HMOs. Within these categories, these are 5 of the most abundant HMOs, and different HMOs may help support 3 functions: digestive health, the immune system, and brain development. It's becoming clear. Preclinical research suggests that HMOs play complementary roles to power the gut-brain immune axis in ways that are unlike any other prebiotic. Abbott is a leader in HMO research, and we are excited to continue bringing new innovations to infant formula.
What is it that makes a place special? That makes it stand out from all the rest? That inspires awe and wonder? From the big encounters to the little ones. Is it a friendly face? An unexpected visitor? A little touch of magical strength? Is it in the silliness, the make-believe, the friendships? Or maybe it's the extra special touches. The ones you didn't know you needed, but you're so glad were there. The ones that take you above and beyond. It's having a friend to laugh with. To eat ice cream with. To sing with. It's the birthday celebrations, calming meditations, and having someone to wish you good night. What is it that makes a place special? It's each person who isn't afraid to give their heart.
Are out there. Ask for the only needle-free nasal spray flu vaccine that helps protect against influenza in people ages 2 to 49. FluMist Quadrivalent. FluMist is an option recommended by the CDC. It may not protect everyone. FluMist Quadrivalent should not be given to patients who are severely allergic to any vaccine component or eggs, or who have had a severe reaction to a previous dose of any flu vaccine, or if they are a child or adolescent taking aspirin therapy. Visit askforflumist.com.
It's early and the sun rises on a new day. But while you're just waking up, nearly 17,000 fellow Ohioans are already hard at work on their family farms, responsibly raising beef from the pasture to your plate. Raising beef is complex, but one thing remains the same: the shared commitment to raise cattle in a safe, humane, and environmentally sustainable way using the latest technology and resources. Today, the Ohio Beef Council is uniting consumers with your neighbors in the beef community. Funded by Ohio's beef farming families, we are your resource for beef strength and nutrition and the latest in safe and comfortable farming practices and much more. Learn more today about the folks raising beef in your community at ohiobeef.org.
Hi, I'm Dr. Dale Block, a medical director with CareSource. COVID-19 has turned our lives upside down in many ways. For understandable reasons, many CareSource members have been reluctant to visit their doctors, dentists, and family physician. Now that many medical and dental practices have resumed normal schedules, I want to encourage you to maintain regular appointments and preventive tests. It's also true for children who need to be seen for important well-child visits and immunizations. As a doctor, I know the best thing you can do for yourself and your family is to stay on track with appointments and immunizations. If you have a medical or dental appointment coming up, call ahead to find out about any changes your provider has implemented. Many practices now ask you to remain outside until you're called in. Wear a mask. If you are accompanying a child to an appointment, have him or her wear a mask if they are over the age of 2. Many providers offer telehealth and telemedicine options where you can have a real-time appointment with your provider through a mobile device or computer. Call your provider's office to understand what might work best for you. At CareSource, your health and well-being is our first priority. Thank you.
This was stomping grounds for me. I used to walk this when I was a young girl. So just to come back and educate and inform and empower and motivate, it's a big deal for me.
I've been doing community outreach in my own city, born and raised in Chester, for the last 5-6 years. So it's very rewarding, helping people out. It's something that it's hard to measure. It's just you get a good feeling. It seems like you accomplished something.
To be able to help somebody who doesn't have the need or the resources or doesn't even know where to begin. And I have the resources and I provide them with the resources. I feel like I sleep good at night knowing that I've helped that one person.
When you're there face to face and they could see that I actually care about them and they could see that I'm actually taking time out of my day to really sit with them and talk with them, that makes a big difference. Good morning, how are you? I'm able to help a member get connected to resources, get connected to their doctor, which they may have transportation issues. They may not even know which doctor to go to. Then you go to all your doctor's appointments, especially if you start to feel sick. We as a company care about you getting the care that you need, and that's what matters, is that people in the community need somebody there that actually cares about who they are, what they're going through, and access to resources and helping them break down barriers that are true to them.
I think it's very important to inform our members, you're not just a number, you're a person. You know, we care. You're very important to us, and if we can help you in any which way, shape, or form, that's what we're here for.
What I love is the fact that we truly care about the member. It's not just about a bottom line or a number, it's about the member. Everything we do is established around the member or the community. Me personally, I love people and I love helping people and I love being there for people, and I'm really compassionate about what I do. So I'll go that extra mile for the member to make sure they have everything that they need.
We care about our members. So they send me out to come track you down because we haven't been able to get in touch with you. Your case managers were, and I'm here to connect you with your case manager and make sure everything is right. So they can make sure everything is right. You can be getting services that you might not even know anything about.
We as a company care about you getting the care that you need, and that's what matters, is that people in the community need somebody there that actually cares about who they are, what they're going through, and access to resources and helping them break down barriers that are true to them.
We care about our members so much. They came up with the COS team. And like I said, boots on the ground, you can't get no better outreach than boots on the ground and people coming to you with information, with services for you.
They're actually surprised sometimes that we actually go this length for our members, so when they feel that, they feel love sometimes. I've heard that I never knew that y'all cared so much about us as a member or as a community. We always thought we were a number, especially coming from the Medicaid office. We didn't know that this was available, so it surprises them that we care so much. And they appreciate it. They thank us all the time. They'll give us a call. Thank you for stopping by, or even when I'm there, thank you. Thank you for giving me company for these past 30 minutes. I really needed that.
It's an overall gratifying feeling. Just to see that look on their face like, oh, okay, I didn't know you came out to visit us. This is the first time I've ever seen an insurance company come knock on my door. We care. That's why we do it.
If you don't have people skills and you don't have a heart for the people, please get that job to somebody else, because it's going to come across. I'm here because I care.
Care is the heart of our work.
Before there are formulations, before ingredients are selected, before anything CeraVe is ever created, there's a partnership unlike any other. While clinical results are important, nothing matters until you see those same results in practice. So we chose to develop CeraVe from the beginning with those most passionate about skin, those who have made skin their life, dermatologists like you. CeraVe listens. Your feedback and real-world experiences are used to innovate from formulation to production. We ask you to assess every CeraVe ingredient, challenge every CeraVe texture, test every CeraVe product, all to continuously provide therapeutic skincare for all. Because the moment of truth, while treating a patient, calls for clinical expertise and proven results. It's coming together to create skincare backed by science and believed in by all. These are the products that will touch your patient's skin, your family's skin, your own skin. When we say CeraVe is developed with dermatologists, it's not just a line or a part of our logo. It's the foundation of CeraVe, so all skin can benefit from the specialty of dermatology.
Hello, my name is Tina Cheng, and I'm the Chair of Pediatrics, Director of the Cincinnati Children's Research Foundation, and Chief Medical Officer at Cincinnati Children's Hospital Medical Center. Welcome to the Ohio AAP virtual meeting. We are especially proud this year as one of our own, Chris Peltier, is the current president of the Ohio chapter. Since we can't be together in Columbus, I want to personally invite you to visit our virtual exhibit page. There you'll find downloadable resources we developed just for you on the topics you are most interested in, like COVID-19 vaccines, the latest on treatments for the conditions you frequently see in your office, and so much more. In our virtual exhibit, you will find vaccine videos to share with patients and families, PDFs on clinical topics most important to your practice, CME opportunities, information for prospective residents, and even a gift from us during these trying times. We have so much more to share with you. We invite you to visit and explore our virtual page, click on our resources, ask us questions, get to know us, and let us know how we can help. From all of us at Cincinnati Children's, thank you for all you do for kids, and our best wishes to each of you for a great Ohio AAP experience.
Most babies around 5 or 6 months of age are able to sit up and maintain their body posture well enough to eat solids. And we'll start with thin solids, so purees and things like that, and try to make it an experience again. So baby might take some of those solids off of a spoon, and they might use their hands and get it all over their face and have a really messy experience. And then that's fun for them too. And then as they get a little bit more accustomed to that, then you can start to increase the thickness and the variety of the solids. in the past, we used to tell parents that to wait until 1 or 2 years of age to introduce foods that might be allergenic. But what we know now is to build that immune system, we should really be exposing babies to these things much earlier. So small amounts of nut butters like peanut butter and things like that, eggs, dairy, those are all fine to introduce at that 6-month time frame. Before 12 months, we don't introduce cow's milk, but it's okay at 6 months to start to introduce things like yogurt, cottage cheese, things like that for baby. And the reason we like those is because babies get things like vitamin D and calcium, potassium, things that are really important for their diet, and it's also something that they can manage easily at their developmental stage. I like parents to look for things that have whole milk in them. And the reason is because there's an additional amount of fat in there, which is really important for the brain development of babies and children. And the other thing with cottage cheese I would like to focus on would be probably smaller curds are easier for infants to manage. And then again, as they get more skillful in their eating, they can increase to a larger size. Some of the things you want to try to avoid would be foods that are unpasteurized because of the harmful bacteria that can be contained in those. Things with added salt or sugar, we want to minimize for sure. While all foods can fit, those things can change the palate of the baby. This is when I like to bring parents back to feeding as learning. And so infants and children will spit food out. They will make faces, they will do all kinds of things, and it does not necessarily mean that they don't like the food. They're experiencing it for the first time and they're reacting to it for the first time. And so the way we teach that child that this is a food that's healthy and nutritious for your body is to keep repeating the introduction of that food. I like to compare it to when you're teaching a child to swing on a swing, where they can first sit and they can hold on to the swing, and then they start to be able to balance as you push them, and then they are able to pump their legs, and then they're able to do it independently. And so we would never expect a child to be able to do that right off the bat. There's a process that goes along with it.
Is the most important person in the world. That's why Enfamil has an expert-recommended amount of DHA. But Similac only has half the amount we do. Shouldn't every formula meet the DHA recommendation? Enfamil is calling on other formulas to raise their DHA amount. Let's give babies more. Sign Enfamil's petition to raise the DHA.
Coverage you need close to home? Lean on Molina Healthcare. With a Medicaid plan from Molina, you get access to high-quality medical, pharmacy, dental, and vision coverage, plus online doctor visits through Teladoc for expert care wherever you are. Molina Healthcare also provides transportation to medical appointments, Amazon Prime for 3 months, a 24-hour nurse advice line, prescription delivery, and more. All at no cost. Get the most from your health plan. Visit leanonmolina.com for details.
I always think of neuro-oncology, and people ask, why did you go into oncology? Because I think it envelops the art and science of medicine. I always tell my team, we're doing God's work every day. This is why we're here. Brain tumors in kids happen in about 4,000 to 5,000 patients a year in the US. So it's a rare tumor. Over the past decade, we've made huge advances in understanding how brain tumors function, what makes them tick. The biology, the genomics, and those aspects of this are going to be critical for us to then come up with better therapies for these kids. So that was actually another really important reason that I came here. What I loved was that it was a sort of a sense that you can do anything here. You know, we want you to build the best neuro-oncology program in the country. What will it take? And I think that sort of aspirational approach is really critical. 20, 30 years ago, we were at the point where a lot of patients with brain tumors passed away from their disease. So that was when I thought, if you're going to dedicate your life to something, dedicate it to this, because we've got to do better. We want to develop novel, out-of-the-box therapies that are going to be not just small incremental change in outcome, but big changes in outcome. But then as they become standard of care, we can expand that to kids, even in developing countries and around the world. And I think this is why this next decade is such an exciting decade for us, because that's exactly what we're working on.
This is Dr. Susan Sweeto. If you see a pediatric patient with a sudden and dramatic onset of anxiety, eating restrictions, or symptoms of obsessive compulsive disorder, such as bad thoughts, urges, or rituals, please consider PANS and PANDAS as possibilities. Group A strep or another infection may have triggered the symptoms and the resulting distress. The good news, PANS and PANDAS are eminently treatable. Early detection and accurate diagnosis are keys to recovery. Therefore, I urge clinicians to become familiar with the guidelines for evaluation and treatment available on the PANDAS Physicians Network website. Thank you.
I met Joe in 1979. We were both working for a major international telecommunications company. Joe headed up a regional sales organization, and I was a compensation administrator.
I was putting together a task force because our salespeople at that time were straight salary, and I wanted them to be commission oriented. And they said, well, put together a task force. And Marty was working in human resources. He was their data guy in human resources at the time. I met with the first task force and explained what we were trying to do and what we wanted to accomplish with it. And Marty comes up to me. It's the first time I'd met him.
I sat down with Joe and told him that he was pretty intelligent for a dumb sales guy.
And we hit it off immediately after that. We became close friends, and it just evolved from there. And that's when, a year or so down the road, we decided to do our own thing and started this business.
We started in 1983, incorporated later in 1984, and originally we took advantage of the divestiture of the Bell system. We were buying equipment at a wholesale level from manufacturers under these non-disclosure agreements and reselling them to small companies, kind of like Parallel later became. And we had all this equipment in the warehouse. Joe got tired of dealing with inventory and wanted to have people around. And so we decided to open what really is Parallel Technologies today.
Over the years, we had, Marty and I, as the business progressed and Marty and I got a little older, we had to think about where we were transitioning the company.
They picked me, Don, Rob, and Brad, who you'll meet from Cincinnati, and said, hey, these guys are the future of the company, and we're going to slowly start teaching them more about the business and transitioning over the responsibilities.
Shortly after the transition to the 4 new owners, Don, Jamie, Rob, and myself, Don brought it to the 4 of us, or the 3 of us, about the ESOP transition, or the idea of the ESOP. And we all listened intently and loved the idea of what the ESOP brings to the company, to our customers, and to our employees.
You know, the more we started to learn about ESOP, the more it felt like the right thing, because it was basically doing well by doing good is a phrase that we heard over and over through you know, the folks that helped walk us through this ESOP process, and it was.
And so we've built a platform now that I think will only accelerate the business. And all the statistical data says once you make this conversion to ESOP, your business will grow because you'll have the leverage of everybody in the staff being ownership.
I'm so excited about Parallel being employee-owned now. I think it's going to be great for this company. We're already like a family, and now everyone is going to be doing more because it's going to benefit everyone in the end.
I feel like I am part owner, and I think that makes me more accountable and as my role at Parallel.
I love it. I mean, I think it gives us all an opportunity to jump in and keep the company going, and we've got something to look forward to.
With salespeople and operations, it's more unifying because we are all working to make that customer happy. The revenue now matters. It's not just revenue for a salesperson, but it's also retirement for everybody.
The owners and the partners have always looked out for us and considered it family, so I think it's bringing everybody together more as a family than it was before.
We have the opportunity now to advance our business with other ESOP companies and to also have a great retirement plan for our employees.
Much more hands on deck. This is their company. How are we going to run it? You know, what does this mean for our day-to-day operations and keeping customers happy and continuing to grow the business?
We have this staff that's already remarkable. We can take them from good to great, great to excellent, excellent to exceptional in that one fell swoop. And we all are in some place. Each part of this business is in there somewhere. And the idea that everybody will be focused on that is exciting.
My name's Lori Robinson.
My name is Ashley Walsh.
My name is Howard Hebb.
My name is Bobby Dameron.
I'm Carrie White.
I'm Ashley Baker, and I'm part owner of Parallel Technologies.
PCC is going to invest in you. Their viability, their success is really dependent on you as an independent practice, and you feel that vibe here. You know that they're in your corner, they're on your side, and they're going to do what it takes to make you a great practice.
The PCC software is pediatric focused. They're not trying to be all things to all specialties. They design what they do specifically for a pediatric office.
It's very easy to transition into it. So if I'm hiring a doctor or a nurse or something, I'm like, oh, you've used all those EHRs, you'll be fine, because ours is the best. It's so easy to use, it's so user-friendly.
From a certain aspect, an EHR is an EHR, right? I mean, there's certain components that you have to have in every visit, and there's certain billing things that you have to do every day and that kind of stuff, and a lot of vendors can do that. What we take away from PCC is most helpful to us is the additional benefits of the practice management aspect.
I've learned, you know, this is how you can look at the health of your practice. Recently, I found out these are the other things we could help you do. I didn't realize that at all as far as working on some projects within my practice, areas where we've tried to fix this and we can't quite. And the client advocate was like, yeah, let's build a project around that. Let's schedule a time and, you know, get on a call and do that.
PCC as a company doesn't just give you software, but they give you practice management advice as well. So they've helped our office get better, not just using the practice management system, not just using the EHR, but they've actually helped our office function better.
Hello, I'm Christina Bennett Farrell and I work at Cincinnati Children's Hospital Medical Center in the Hematology Department. I serve as the project manager for a regional sickle cell disease network, Sickle Treatment and Outcomes Research in the Midwest, or STORM. This network was established to improve outcomes for individuals with sickle cell disease living in the Midwest. And one of the goals of STORM is to increase provider knowledge about evidence-based management of sickle cell disease. STORM TeleEcho, a replication of the Project Echo telementoring model, was launched in March 2016 as an innovative lifespan approach to provider education in the Midwest. We use web technology to link expert interdisciplinary specialist teams with clinicians, allowing experts to mentor clinicians, provide feedback on difficult patient cases, and share expertise via monthly case presentations and didactic educational sessions. Also in the hematology department at Cincinnati Children's is Deidre Haygood, who serves as the newborn screening coordinator. The Region 1 Ohio Department of Health Sickle Cell Services program provides follow-up services, including confirmatory testing, inheritance risk counseling services, care coordination and referrals for preventive and evaluative disease management. Deidre provides educational presentations about newborn screening, sickle cell trait and sickle cell disease to healthcare professionals, community organizations, affected families, and the general public. The program also produces and distributes educational materials on newborn screening, sickle cell disease, sickle cell trait, and athletics. For more information about any of our programs or projects, please visit the resources and links we've provided on this page. Thank you.